Today is June 7th, Tuesday, and we've convened the Board of Health for the City of New York. It is 10:01 a.m. and I'll call this meeting to order. To begin, I'll conduct a roll call. Are the following members present? Pamela Breyer. Just say here, please, if you can.
You're on mute, Pam.
I know. Oh, there
Good
we go.
morning.
I am here. Good morning.
Good morning. Dr. Sixto Caro.
I think he's not able to come, actually. Maybe I'm wrong about that.
Okay, understood. Dr. Joel Foreman.
Here.
Hello. Dr. Sydney Hankerson.
Here.
Hello, good day. Dr. Mitchell Katz. Okay. Dr. Susan Klitzman.
I don't think she's on the board anymore. I don't think. I could be wrong.
Okay, my team can clarify that. Dr. Simona C. Kwan.
Here.
Hi, good day. Gail Neowith.
Here.
Hello. Karen Redlener.
Here.
Hello, good day. And Dr. Lynn Richardson.
Here. Hello.
Hello. Thank you so much. It's a pleasure today to be joining you for my first Board of Health meeting. My name is Ashwin Vasan. I'm the 44th Commissioner of Health of New York City. As you all know, and you're in your service, we thank you for your service. The Board of Health has an illustrious history for its role in advancing public health in New York City. And of course, most recently in the path-breaking work that it's done to support the city throughout the COVID-19 pandemic. I am very much looking forward to working with all of you during my tenure as commissioner. I'll speak just for a couple of minutes about where I think the priorities are and what our priorities are as a city and as an agency for this current era we're in and into the next few years. The city, the country has been under an existential stress test due to COVID-19. Public health has been placed under enormous strain and stress, and frankly, it has emerged with much to be proud of. It has also emerged with much to be learned about areas to strengthen, areas to bolster, areas to reposition for the future, not only to respond to the next public health emergency we may face, but of course to tackle the ongoing parallel pandemics and structural health inequities and population health issues that we have faced for years. And so we are entering a new era of public health where the visibility of the field is at an unprecedented high, much of it for good reason and to celebrate the enormous impact of the COVID-19 response, but also an opportunity to retell the story of public health and all that it does to prevent illness, prevent suffering, prevent death, and to improve health and well-being in our city and in our society. As a field, if the New York City Health Department, in its role as the largest local health department in the country, one of the most well-resourced and well-staffed public health departments in the city, if we are not leading on this issue, we are not working to redefine the public health business model for the 21st century, then I'm not sure who else is in a position to lead on this in the United States. And so we're very excited to take this moment. Obviously, I've come into the role with a focus on mental health and really responding to what I see as a second pandemic of mental health conditions across the board, seen in epidemiologic increases in anxiety, depression, mental health crisis calls, obviously falling disproportionately on people who came into the pandemic with pre-existing mental health needs, as well as our young people and our children. And for too long, I think mental health has sat outside of our public health purview. We are, of course, one of the few health departments in the country that has explicitly integrated mental health into public health, but I think there's more we can do to ensure that we are bringing all of the tools to bear and all of the frames and approaches we have successfully used for diseases, both chronic and infectious, to our mental health crisis that is grounded in primary and secondary prevention, but also, of course, in long-term care, treatment, support, and recovery. All the while using the best available population-level data to both make inferences, design programs and policies, and measure our success. And so I laid out the vision for mental health for New York City in a speech now 2 weeks ago at the Henry Street settlement, where we really outlined a focus on 3 basic populations. That is our children, youth, and families, people with pre-existing severe mental illness, and people at risk of overdose with our rising overdose crisis, and more explicitly linking our overdose crisis to underlying mental health needs. In addition to our focus on mental health, we continue to be focused on COVID-19 recovery and investments into public health infrastructure. The health department has made significant strides in investing in frontline workforce, partnering with community-based organizations, nearly 100 of them, through our Public Health Corps program, and the impact that that has had on vaccination rates, on distribution of PPE testing, and the like. How then do we continue to invest in this to apply to a whole range of chronic and underlying health issues in our society, chronic diseases, mental health, maternal health. And so building that workforce is a core piece of our public health infrastructure, but it doesn't just apply to people. It's also really a critical reexamination of our data systems, the interoperability of our data within public health, let alone its ability to talk to other systems, whether it's administrative systems in housing and benefits, healthcare systems, and the like. We must push our data systems forward to make faster and better decision-making so we can not only respond to emergencies, but continue to tackle our ongoing health crises. And of course, public health has a lot to grow and learn about communications, strategic communications, how to communicate certainty in times of uncertainty and rapid change. And there's much we can learn, and that requires investment and care. In addition to COVID recovery, we will continue our focus on parallel pandemics, lifting up, in particular, revitalizing the work of the agency on chronic diseases. This administration in particular is focused very much on a holistic approach to tackling our epidemics of diabetes and cardiovascular disease and obesity. You've seen the administration put out executive orders about transforming our emergency food purchasing program, working upstream to change advertising of sugar sweetened beverages and fast foods on school property, on city property, and of course working with our partners in the public hospital system to make healthier choices easier for patients and for people interacting with our healthcare systems. This is just the beginning of what I think is a revitalization of our work on chronic illnesses, taking both a population-wide approach as well as a health equity-driven approach. We'll also be focusing on environmental health and the impact of climate change on health, and really how that is falling disproportionately on low-income communities and communities that are already at the tip of multiple intersecting risks. And lastly, we continue to focus on health equity and embedding health equity and anti-racism as a core pillar of our work at the health department, ensuring that and really reinforcing the notion that if we want to see meaningful population level decreases in disease and closure of health inequities, it requires both that we take citywide approaches and specific health equity approaches that focus on the communities and the neighborhoods most hardest hit, both by COVID as well as a host of intersecting health needs. And so building upon our really strong history of work there. So I'm eager to work with all of you during my tenure as commissioner on these priorities and look forward to discussing them in more detail going forward. So with that, let's move into the approval of the minutes from December 20th, 2021. First, are there any corrections to the minutes from the December 20th meeting?
Commissioner, if I can just add that Rosa Gill, Dr. Caro, and Dr. Mitch Katz have joined the board meeting.
Oh, very good. Hello to all. I'll just take a note, 1 second. Okay, thanks so much.
It also looks like Dr. Foreman has his hand up.
Okay, Dr. Foreman, please, floor is yours.
Hi, good morning and a warm welcome. It's a pleasure to meet you and join. I put in the chat, I found only two minor errors in the minutes. One is substantive. It's page 44, line 19. There's a term that says anti-health that I believe should have been anti-racist. Lisa Landau agreed with that. So that's the only, and the spelling of my name in one place, but otherwise seemed good.
All right, thank you for that. Are there any further corrections? So if there are no further corrections, can I have a motion to approve the minutes from December 20th?
So moved.
Okay, do I have a second?
Second.
Great. All those in favor?
Aye.
Aye.
Any opposed? Okay, very good. The minutes from the December 20th meeting are approved as distributed and amended. Okay, now on to items on our today's agenda, which will be very brief. We are here today to review the declaration related to the Board of Health virtual meetings. Our presenter is General Counsel from the New York City Department of Health and Mental Hygiene, Lisa Landau, and I'll turn the meeting over to her.
Thank you, Commissioner, and good morning to everyone. Nice to see everyone here. We'll be brief. We're here really to forecast how we're going to meet in the near future and maybe in the more distant future as well. So next slide, please. Thank you. So recently, the state open meetings law was amended, and it sets out when a public body can use video conferencing in conducting its meetings. And as all of you know, during COVID, the board has been meeting remotely. It's actually the only way that I've met with you over these 18 months or so. The new law allows for the Board of Health to continue to meet via video conferencing, like we have been, during a health emergency declared by either the governor or the mayor, if circumstances like high rates of transmission would impair the ability of the Board of Health to hold in-person meetings. And so we have the situation currently where the state of emergency has been declared by both the governor and the mayor. Next slide, please.
Lisa, I don't seem to see these slides on the screen. It's probably me, but I don't see them.
Is everyone?
They just came up.
Sorry.
Okay. Okay.
Yeah. So adoption of the declaration today will allow for the board to preserve the status quo and meet remotely until circumstances improve, transmission rate, for example. So the next meeting in June will still be remote, but perhaps in August or September, when the board meets again, the board would adopt a resolution to have in-person meetings with video conferencing for board members available where there are extraordinary circumstances. That is what the basic rule sets out in the newly amended open meetings law. Essentially that so long as at least a quorum, 6 members for our Board of Health, are gathered in person at a physical location open to the public, like Gotham here in Long Island City, board members can participate and vote in meetings via video conferencing under extraordinary circumstances. And those circumstances would be specifically spelled out in the resolution that would be considered in August or September. So not today, but I wanted to give you a sneak preview as to what's to come when it feels safer perhaps to meet in person and start down that road. But for now, the declaration before you will preserve the status quo, as I mentioned, and allow us to continue to meet remotely in the near future. So with that, next slide, please. If there are any questions, happy to entertain them now.
Well, I'm glad to move the resolution so we could have a brief discussion, maybe. Yes? Or can we just go ahead? I do have something to say. Should I go ahead?
Sure.
Sure.
Good.
Can I have a motion
So-
to approve the declaration? You want to have a discussion on this
Yeah,
motion or something else?
I wanted to ask a question about this.
Oh, please,
actually.
yes, now's the time. Now's the time, Pam.
Yeah, now mind you, it is a little belated to be raising this issue after we've been meeting virtually for 2 years. But I actually am a believer in public meetings where the public can listen in and watch, and especially in terms of healthcare, which touches so many lives. I wish more people would watch and be sort of advisor or listen in or something, or come to meetings, which is unwieldy. But would there ever be a mechanism, should it come to pass that we're not going to be able to meet in person for a while? Is the technology good enough that we can make these meetings open to those who want to listen in? I'm, as I said, I don't know why I never said this sooner, but.
I think the meetings are currently open to the public.
Are they? Okay.
They
Oh.
are able to be, they're not here in the meeting.
That's okay.
in
Neither
the
are we.
Zoom, but they're watching it live on
Okay.
YouTube currently.
Oh,
So they heard your question just now and they're hearing my response.
well,
So
thank you.
so it is
Excellent.
open to the public now, and I think the
Okay.
technology is pretty good. But I think what Lisa is referring to is, for today, we
Oh, I know.
are- we'll vote on preserving these meetings as virtual to allow us to conduct the business of the board today and for the next meeting. But
I
we would like
understand.
to move towards a hybrid or an in-person preferred approach
Well, actually-
for following meetings.
Yeah, I'm very embarrassed that I didn't know that. And that actually makes me really happy. I understand the motion today, which is more procedural. I guess my point was more sort of philosophical in a way, that you want to invite people to see what's going on at its premier health department. But thank you. Good.
And I share your commitment to making these meetings open and public. I think that's a very important role for us as public servants, especially in health. Any other questions from board members about this motion? Okay, so can I have a motion to approve the declaration of New York City Board of Health relating to virtual meetings?
So move.
Can I have a second?
Second.
Okay, now I'll take a vote from each member. And I'll just go down my screen to list names. Dr. Joel Foreman,
Yes.
Dr. Rosa Gill,
Yes.
Dr. Simona Kwan,
Yes.
Dr. Sydney Hankerson,
Yes.
Gail Neowith,
Yes.
Dr. Sixto Caro,
Yes.
Dr. Mitch Katz,
Yes.
Karen Redlener,
Yes.
Pam Breyer,
Yes.
Dr.
Yes.
Lynn Richardson.
Yes.
Did I miss anybody?
I think so.
I think that's everybody on my screen.
Mhm.
Did I miss anybody? Team? Okay. So with unanimous votes in favor of the motion carries. So that's all of our business for today. I really want to thank you as we continue to take steps further to protect the health and welfare of New York City. I thank you again for making yourselves available. I wish everyone health and safety. We are planning to re-adjourn another Board of Health meeting later this month to discuss additional topics. That'll be a more fulsome agenda. But for the moment, we're adjourned, and I wish you all a peaceful and healthy day.
Thank you.
Thanks, everyone.
Thank you.
Thank
Take care.
you.
You all.